All right, good morning. We have a question right off the bat that I want to get to because this is a question that you guys might actually have as well. It says, good morning. I have a question regarding the end of the closing on the state exam. Do you have to say, I think about my steps and make any corrections and let the evaluator know that I am done? So this is a very good question. This is one that a lot of people have. Remember that these videos that I'm showing you are designed to teach you how to perform the skill. So what I'm saying is focused on you guys. Okay, I'm instructing you. But during the test, you do have to say, my skill is done, or my task is complete, or I'm finished, or something like that, because the ability to make corrections ends. The ability to make corrections ends when you end the skill. So the evaluators aren't going to end the skill for you. Okay, so they're not just going to say, okay, you're done and move on. You have to declare that you are done. Does that make sense? Yes. Okay, so the rest of this is what I want to talk about here. It says, do you have to say, I think about my steps, make any corrections, and let the evaluator know that I am done? So we know we have to say, I'm finished or I'm done. But the rest of this, you don't have to do out loud, but you should still do it.
I think on the first class you said that you only actually have to wash your hands for one of the tests because it's not enough time to do it for all 3 tests.
Right. So during skill 1, you're going to do your opening, knock, knock, knock. Hi, Mr. Jones. My name is Patty. I'm your CNA today. I'm here to whatever. Is that okay? Pull curtain, and you're physically going to go to the sink and wash your hands. Then you're going to do your skill. And at the end of the skill, you're going to do your closing. Thank you very much, Mr. Jones. Is there anything else I can get for you while I'm here? Here's your call light. Would you like a magazine before I go? Are you comfortable? Clean environment, bed in the low position. Open the curtain, and you're going to go to the sink and physically wash your hands. Then you're going to think about your steps, make any corrections, and then say out loud, my skill is done. After that first skill is over, when you're moving on to skill 2, the evaluator is going to stop, and they're going to say, from this point on, you can simulate hand washing. Simulate just means say. It's a way of shortening the test a little bit.
Should you do it for 60 seconds?
No, just say. Remember, simulate means say. So we wouldn't have to say for 60 seconds that we were washing our hands. So you would just say, I'm washing my hands now. Okay, good. Good. So it's important that we do the skills in the order that's presented. So the easiest way for me to explain this is wash your hands until they tell you not to. It's really that simple. Wash your hands until they tell you not to, that you can simulate hand washing. Okay? I'm just letting you know that it will be the first skill, the beginning and the end of the first skill. Those are the ones that they grade. From that point on, they'll tell you. But you don't have to remember all that. You just have to do what they tell you to do. Okay, good. Any other questions on that? Okay. So good morning. Rosie says, good morning. I failed my written exam. I passed the skills evaluation. Rosie, you might want to get our ebook. I'll put it in the chat for you. That will help you with the written test. Good morning. Good morning, Miss Patty. I want to let you know I passed my skills test on Saturday, and I'm officially on the registry for Pennsylvania as a CNA. Congratulations. Good job, Jen. All right. Let's see here. Very good. Good morning. And question, are you allowed to ask a patient approximately how much they weigh before you weigh them on the weighing scale? So, and good morning, Endoramana. Okay, so let's talk about face question. For the state exam with Prometric, we do not weigh patients. It's not a tested scale. You won't have any, any reason to weigh anybody on the state exam. But in a clinical setting, this is kind of relevant. And the answer is it really doesn't matter. But the problem here is that if you ask somebody, what do you normally weigh? That kind of, how do I put this? It could predispose you to miss an observation. Okay. So if you just go in, it's called objective assessments. So if you just go in and weigh somebody, no matter what they normally weigh somebody, and then you want to look at their previous weights to see if there's a change. If you ask somebody, what do you normally weigh? I mean, that it's okay to do, but the problem is that they may not be exactly correct, or the scale that they weigh themselves on might not be as calibrated as what you're using. So now you're basically saying, okay, there's a weight change, but we aren't real sure whether it's a weight change that's based in reality or based in the fact that they use something different to weigh themselves. Does that make sense? No two scales weigh exactly the same. So I don't know that I would ask that. I think it kind of removes that objectivity. Okay. But for the test, it's not going to be an issue. Okay. Faith asks, okay, so this must be on that same topic. Failed mine on Credentia, North Carolina. Good morning. I guess I was off more than what the evaluator got. That could be, Faith, but I'll tell you what probably failed you regarding weight is that you didn't zero the scale out properly first. When you're weighing on a balance beam scale, it must be zeroed out before every single weight. And if you did not zero that scale out before you weighed the patient, that's an automatic fail. So I would assume that it's probably based on that rather than the weight that you got. All right, so you had over the weekend chapters 5 and 6. 5 is on dementia, 6 is on skills. So you should have read those 2 chapters, taken the tests on page 185 and 186, and then graded them. So when I call your name, if you can tell me your grades. Marwa? Thank you. Do you have 4 for me? That's fine. Bobby?
85 on 5 and 90 on 6.
Do you have 4 for me? It'd be page 184.
Half of it.
Okay, that's fine. Kathy?
I got 95 and 85.
Thank you. Do you have 4 for me?
Yeah, right here. 4 and 5.
I need 4, 5, and 6.
And I do have 6 and I had 100 on 6.
Okay. So 95, 85, and 100. Okay. Taylor? Toya?
100 on 5 and 95 on 6.
Thank you. Jade? Thank you. Dylan?
95 and 100.
Thank you. Ezekiel?
80 and 90.
Thank you. Veronica?
95 and 85.
Thank you. Danielle? Antea?
180.
Thank you. Do you have 4 for me?
I got a 90.
Thank you. Haiti? Stacy?
-2, -1.
Okay. And
4,
I actually need 2, 3, and 4 from you.
-2.
Okay.
-3,
Thank you. Corey,
95 and 100.
do you have 4 for me?
I don't.
That's okay. All right. Okay. Any questions on what we've gone over so far? Faith is asking if you get the same, when you retake the test, if you get the same skills. Usually no. You usually don't. All right, class is half over, guys. We only have 3 classes left after today. So we're moving through this very, very quickly. If you have not registered for the test yet, you probably want to get on that and register as soon as possible for 2 reasons. Number one, the further out you get from the class, the less confident you're going to feel. And the more you're likely to forget what I've said in class. So you really do want to register for the test now. So you'll be testing about a week or 2 after graduation. Now, the other reason that you want to register now is because we're about to go into holiday season. And they do test 7 days a week, but they don't test on holidays. So that means that anytime we have a holiday coming up, it's going to impact your testing date. So you really want to get in before Thanksgiving. Does that make sense?
I watched your live stream, I think 2 days ago or so. I watched the last 45 minutes of registering and whatnot.
Mm-hmm.
Are there any waivers for the registration or anything like that? Like you have to pay like 155?
Right, 155.
So is that right after you register, it prompts you to pay?
Right, you're going to pay during registration. It's actually on the online registration form. Or if you send in the form that I gave you, I'll get that for you. Remind me after class. When you send that in, there's actually a payment page on there that you would indicate your payment.
Can we select a days for our examination?
You don't select, you register, and they assign you a date. So, it could be 7 days a week. Could be a Sunday. It could be a Tuesday. They assign you the date. If that date does not work for you, you can call in as long as you do it quickly. So you get the date, it doesn't work, you call in and say, hey, I can't make it. They will work with you on the phone for a mutually agreeable date. But if you wait until 3 days before your test to call and say, hey, I can't make this test date, they're not going to refund. That you would have to repay because it's too close to your testing date to put somebody else in that spot. So when you get your testing date, if it doesn't work, you need to call them right away to change it, to make other arrangements. It is. You're going to take both the written and the skills, but remember, 8 people are there to test, and all 8 people have to go through the skills test before the written in most cases. Sometimes they'll do the written first, but usually it's skills first. So if everybody has about 30 minutes, give or take, that's 4 hours. Does that make sense? So yes, you really should plan on being there somewhere around 6 hours, generally speaking. Okay. So all day.
So the result is
You'll get the results at the very end of the day, right before you leave. They print off the results and give them to you as you exit the building. You don't get a certificate. You get a printout basically that says, congratulations, you passed the written. Congratulations, you passed the skills. It'll show you all your deficiencies. And then about 7 to 10 days later, you're going to get a blue card from the state of Florida, which is your certification. But it's not like a certificate. It's a blue card. So there are wallet cards, but there's also on the card itself, and I have a whole presentation for this on class 8, but on the blue card itself, it has a perforated certification that you can put up on a wall if you want to. It'll have a wallet card, and then down below, it gives you all of your information for renewal. Okay, but we're going to go through all of that on class 8. All right. So we have the game show coming up tomorrow. I do a CNA practice test game show. So if you're concerned about what kind of questions to expect on the state exam, on the written test, this is a great way to kind of find out the types of questions they're going to ask. I pick a subject off of the test for every single game show. I write the questions at the time. So tomorrow I'll be writing, or tonight I'll be writing questions for tomorrow's game show. It's a new batch of questions every single time. And you compete for prizes. So this is on YouTube. If you go to youtube.com/4YourCNA, when a question comes up on the screen, you're going to put into the chat the number 1, 2, 3, or 4 based on the choice you want to make. Hit the 1 second. Hit the send button, and my program keeps track of the points that it awards. First place gets a T-shirt. So, and you saw the T-shirt on last class. Second place gets the card game, which we have here, and third place gets a badge holder. I have some other prizes that'll be coming after the first of the year, but those are the prizes for right now. All right, so let's review real quick. How do we know what to do with each patient? We follow and it's the care plan, the whole care plan, and nothing but the care plan. While we're performing the skills on the care plan, we're going to watch for observations, and then we report those observations to the RN. Every skill starts with an opening. Every opening starts with a knock. So we have to knock at the beginning of the opening. And your opening sounds like this. Knock, knock, knock. Hi, Miss Jones. My name is Patty. I'm your CNA today. I'm here to whatever. Is that okay? Close curtain, wash hands, get supplies. It must be done in that order. Our cardinal rule here is that we don't touch the patient until our hands are clean. We always evaluate whether we need gloves. We don't necessarily need gloves for every skill, but we do need to evaluate the need for gloves for every skill. And we're going to wear gloves if we're going to touch body fluids, personal skin, or non-intact skin. If you do wear gloves, the first thing you should touch with those gloves is the patient. Once you've touched the patient, you got to pay attention to the other things in the environment so you're not cross-contaminating. And then you have to remove those gloves correctly by pulling up and then going under. Anytime we use supplies, we use a barrier. That barrier provides a clean area for our clean supplies, and we can only touch supplies with clean hands. So barriers all about clean. You can't allow supplies to touch your uniform. So we always go get the barrier first, put it on the table, and then go back and get our supplies and put those on the table. That way we're not accidentally holding those supplies up against our uniform. Anytime our patient is uncovered or undressed, we're going to use a privacy blanket. This is used not just for privacy, but also to keep the patient warm. When you put a privacy blanket on, we don't snap it or shake it. We put it on over the sheet and pull that sheet down underneath. If we're wearing gloves, the gloves have to come off before we pull the privacy blanket up. Linen rules. Now, these are mostly repeats of rules that we've already gone over. So linens can't touch your uniform. You have to have clean hands to get your linens. Don't snap or shake the linens. We also learned that clean rolls toward me, dirty rolls away. And this is how we prevent that gross cross-contamination. Nothing can touch the floor. Not clean, not dirty, nothing. And anything that we take and don't use must be discarded. Patients must be in the middle of the bed at all times. And you can't rely on side rails to keep your patient safe. So when we have to turn a patient onto their side, we're going to scoot them toward us and then roll them away so that after the roll, they remain in the middle of the bed. This one rule right here is responsible for about 30% of all failures on the state exam. So this may seem very simplistic, but it's super important. When you're doing skills, they're watching to see how close that patient is to the side of the bed. If you roll somebody over and they're too close to the side, stop what you're doing, pull them back onto their back, scoot them closer to you, and roll them to the middle again. Don't just assume, well, I did the steps, I don't have to worry about it. It's not about the steps. Who's it about? The patient. Good? Make sense? Okay. All right, patient must always be in the middle of the bed. When we're washing things, now washing is a big part of what we do. We have many washing skills. All bathing is done the same way. We don't add soap to the basin. We use a paper towel to turn the water on. We should feel the water temperature. It should feel warm, not hot, not cold, but it's not just us that has to check it. So does the patient. We're going to use the leaves method for wet body openings. We're going to get to that today. Whatever we wash, we rinse. Whatever we rinse, we dry. We don't get the surface wet, whether it's the table, the bed, whatever. So you really want to wring out those washcloths, no drippy wet washcloths. And then if we put lotion on, we warm it up first and then wipe off the excess. Anytime we have a basin for washing, we have to clean it. So for the test, this is pretty easy. You dump it, rinse it, dry it, and store it. That's it. And then we have the closing. You have to end skill with clean hands, but also with a patient that feels cared for and cared about. So your closing, we want to make sure the patient's in a clean environment, the bed is in the lowest position, the patient has access to the call light. We ask if they're comfortable and address any preferences that they have, open the curtain, wash our hands. And then if we have to document, that would come after we wash our hands. But since we have to end the skill with clean hands, if we document, we have to wash our hands again. Good. So that's a review of everything that we've learned so far. Any questions on any of it? Okay. All right, so let's get into the skills that we've learned. This is going to be a brief review of all of the skills that we've gone over to this date. When taking a pulse, we always support the arm. Don't leave it kind of hanging out in midair. We always report pulse readings over 1 minute, but how long we count will depend on our care plan. Normal is between 60 and 100. And we're going to use our fingertips, not the flat area of our fingers. The pulse is located at the very top of the bendy part of the wrist near the bone. Say start and stop during the test. And in Florida, you have to count with both evaluators. This is a documentation skill. Dressing a resident. We remember this by USA First. We always get our clothing before we undress the patient. That minimizes exposure. USA First means undress strong arm first and dress weak arm first. That minimizes the motion necessary by that weaker arm. We lift from below, supporting all joints. We don't overextend or force movement. Your patient has to look good at the end, so adjust clothing as needed. Put all dirty items in the hamper and put the call light in the stronger hand. We learned hand and nail care. This was our first washing skill that we learned. We support the wrist and arm at all times. We soak the hand in water. Whatever we wash, we rinse. Whatever we rinse, we dry. The hands should be on a towel, not on the hard table surface. So make sure there's a towel there for your patient's hand. We use the beveled edge to clean under the nails and of the orange stick, and we wipe it off in between nails. We don't want to transfer pathogens from one nail to another. Using an emery board, we'll file in one direction toward the middle, and we apply lotion last. Making an occupied bed, we change the bottom sheet a half at a time. So the patient has to be on their side in the middle of the bed while we do this. Clean rolls toward me, dirty rolls away. We'll remain behind the patient's behind while we do this. We smooth any wrinkles, we make hospital corners, and then loosen the sheet over the toes. We replace the pillowcase with the opening facing away from the door. Let me talk about that because we didn't talk about that in class. Why is that important? Well, a lot of people walking up and down the hallway, and this was especially important when we had TB. So TB is tuberculosis. So when TB was a big problem back in the 30s, 40s, 50s, and even into the 60s. It tended to move on air currents. Now, it was droplet based, but it did still, because it was so minute, did still tend to move on air currents. So those air currents coming in could get inside a pillowcase. And now your patient is breathing in all of those bacteria. So in order to help combat this, the pillowcase openings always faced away from the door. So those pathogens didn't have a warm, dark, moist place to settle. Now, it's not as important anymore, but TB is on the rise, guys. So we want to make sure that we understand this, this concept, that when we're in an environment that has a high level of droplet or airborne based pathogens, the inside of that pillowcase becomes an incubator. So it is better to keep that pillowcase facing away from the doorway. Okay. All right, sideline position. We're going to scoot the patient toward us, arm up, arm over, leg bent, leg angled, and then we turn them on their side. Pillow behind the back in a roll to keep them on their side. Pillow between the legs, specifically between the knees and the ankles. The top leg should be kind of in front of the bottom leg, so it's not laying directly on top. Legs are heavy, right? You don't want it directly on top of that bottom leg. Pillow under that top arm to get it into a neutral position, and then adjust the pillow under the head. So it's supporting the head and the neck, not underneath that shoulder. Call light should go on the bottom hand here, because if you put the call light in the top hand, which is kind of what most of us tend to do, we put that call light in the top hand. When we do that, that cord goes right across their neck, and that could be a choking hazard. So call light in the bottom hand. Foot care, just like hand and nail care, a little lower. We're going to soak the foot, wash the foot, rinse the foot, dry the foot. But why are we doing foot care? Is it to clean the foot? Observation. So during this test, during the skill for the test, you need to say, I'm looking at the foot, or the skin looks clear, or I'm not seeing any red areas or sores. You need to let the evaluators know that you understand this skill really isn't about washing. It's about looking. When we're all done with this, we're going to put the patient's sock and shoe back on. Now, this is a question that came up last class. It was actually put in, I know that camera's driving me nuts. The last class, somebody put this in, and I didn't have a chance to address this. But during the test, your patient isn't going to have a clean set of socks just laying around ready to be put on. You guys are the patients for this, and you probably aren't taking a clean pair of socks with you to the testing center. So for the test, this care plan specifically says replace the patient's sock and shoe at the end of the skill. So it's telling you, put on what they had on. Okay, does that make sense? And it's because the test knows that there are no clean socks to use for this. But in a clinical setting, if we've washed the foot, clean feet need clean socks. So put something clean on. Mouth care, it's just brushing teeth. Nothing really here to learn other than the patient must be in an upright sitting position for this skill. We want to protect their clothing with a towel, because as they spit and as you brush, toothpaste is going to kind of fall down onto their chest. We wet the toothbrush before we apply toothpaste. We brush all surfaces in the tongue. We're going to let the patient rinse and spit as often as they need to. Okay. Remember, if you use a lot of toothpaste, they're going to be rinsing a whole lot for the test. So limit the amount of toothpaste that you use. And leave the patient's mouth clean and dry. When we count respirations, we don't want to let our patients know that we're counting their respirations. We're going to say vital signs instead. In and out counts as 1. Normal is between 12 and 20. You can use an alcohol pad to make it easier to visualize. You will say start and stop when you're counting so the evaluators can keep up. And this is a documentation skill. Range of motion. We do exercises to retain function. Remember, we don't do pain. If the patient gets to here and says, ow, we don't go beyond the ow. Then we let the nurse know, hey, we got to here and got ow, and let them deal with it. Not our problem. So we aren't the no pain, no gain gang. Not us. CNAs do exercises simply to maintain what's already there, and we follow the care plan. The care plan is going to tell us what body part, what exercises, and how many repetitions. We just follow the plan that's set up for us. Flexion extension is up, down. Abduction, adduction is side to side. And rotation is around. Good? Any questions on anything that we've gone over? Do you see how much we've learned in 2 weeks?
When you're brushing the patient's teeth and they have the pillow behind their head, should you scoot the pillow down?
Yes. Yeah, you should. You should. But we want to do that after we wash our hands because we can't touch the patient. Okay. All right. Any other questions before we move on? Let's go to page 80 in your book. We're going to learn another range of motion. Okay, so here's a question. Credentia tells you to wait 24 hours to get your results. They send you an email to open your Credentia account to read your results. Yes, that is correct. So here in Florida, we test with Prometric. There are 5 testing agencies used all over the United States. Every state picks their own. Most people don't really understand the mechanics of the state exam. Prometric is used by about 13 states right now. Credentia used to be Pearson VUE, but now they're Credentia. It's used by about 15 states. And then we have one called DNS Headmaster. They're actually growing in popularity. Headmaster is used right now by about 18 states. And the Red Cross is used in 1 or 2 now. They're kind of going away. And then we have state specific, where each state creates their own testing process. Prometric is one of the big ones. Prometric is unique because all Prometric, doesn't matter what state you're in, tests exactly the same. So here in Florida, we have Prometric. Up in New York, they also have Prometric, same test. In Texas, also have Prometric, same test. Not the same with Credentia. With Credentia, even though they have many, many states, every state is done differently. So when you're talking about Credentia getting your results in 24 hours, that's in the state that you are in. And I think, Faith, you're in North Carolina. So that's just that state. Other people who test with Credentia, they may not get their test results for 2 or 3 weeks. Here in Florida, we get them same day. So we don't have to wait. I mean, can you imagine the stress that causes? Right. So we don't have to wait. We're kind of fortunate in that. So, and then Audie asks, should we use the same supplies for the next hand or leg when washing? And the answer to that is, for the test, you only have to wash one hand or one foot. So you're not going to use the same supplies. You're just going to wash one and move on. In a clinical setting, yes, you can use the same supplies to wash both hands. Belongs on the same patient. It's perfectly okay. All right, so let's go to page 80 and learn another range of motion. Before we get into this, I do want to send out a happy birthday to my mom. So happy birthday, Mom. Don't know if she's watching, but if she is, she deserves a shout out. Okay, so when we're looking at this particular skill, range of motion of the hip, knee, and ankle, we have to think about the range of motion of shoulder that we already learned. All of these principles down here tell us the framework of how to perform this skill. Skill specific is here. All of those principles are spelled out. I've got a video for you. And test specific information is down here. So we're going to follow the care plan. We'll do our opening. We'll evaluate if we need gloves, and we'll do our closing. We just went over this, so we already know this skill. We know that we support the extremity near the joints. We know that we lift extremities from below with a flat palm. We move slowly and smoothly all the way to start. Flexion extension is up, down. Abduction, adduction is side to side. And rotation is around. So there's nothing really to learn with this skill. You already know everything you need to know to do this skill. So let's look at the care plan that's going to tell us how to do this skill on this patient. So our care plan at the top, page 81, tells us to provide the following range of motion exercise to the resident's right hip, knee, and ankle. Flexion extension. So if you remember, flexion extension was up, down. So we're moving the leg up, down on the hip, knee, and ankle. It's going to tell us how many repetitions, in this case, 3. And it tells us the patient is not able to help with the exercises. No supplies. Step-by-step instructions are here. Tells you exactly how to perform this particular skill. Now, when we're doing the hip and knee, it's a 2-for-1 exercise. And this is actually kind of important. So this is the only one that's a 2-for-1 exercise. And the reason for this, let me move this over real quick, is when you bend the knee up to the chest, it bends the hip and the knee at the same time. You can see this leg is straight. So if you bend that leg up, it bends the hip and the knee at the same time. So we're exercising both joints with one exercise. And you want to do it this way. You do not want to exercise the hip alone. Like with the arm, we brought the arm straight up and back down, right? So that was flexion extension of the shoulder. We don't want to do that with the hip. We don't want to bring the leg straight up and back down. And the reason for that is the sciatic nerve. So in your spinal column, you've got your spinal cord, and then you have a ton of nerves that come off of that spinal cord. Well, at the bottom of the spinal cord, it actually branches off into 2 big nerves called the sciatic nerves that run through basically your butt area and down into your legs. Do you see how straight those nerves are and tight? Okay, so those nerves are stretched pretty thin, pretty, they're kind of stretched. Well, when we try to lift our leg up like this, that pulls that nerve super tight. When you're young, you can do this because your muscles are very flexible, your tendons are very flexible, and your nerves are super stretchy. But if you remember me saying on Wednesday that as we age, we get less bendy. Do you guys remember me saying that? We get less bendy. Well, that's what happens here. When we're working with older individuals, when we lift the leg up like this, it pulls that nerve super tight, and that causes pain. And that pain can last for weeks to months. So we don't do what we call a straight leg raise with our patients. Let me go back a slide to show you. When we bend the hip and the knee, it causes slack in that nerve. It doesn't pull it tight. Good? Does that make sense? Okay, so we're going to bend the knee to the chest and back down to the bed 3 times because that's what our care plan told us, flexion extension 3 times. And then we're going to move on to the ankle. We're going to bend the foot forward and back to stretch that ankle and stretch that tendon along the back side of the your Achilles, basically the back side of your ankle and heel area. We want to stretch that. If we don't stretch that routinely, the foot will that tendon gets tight and the foot actually goes forward. and you can end up with contractures. So moving that foot forward and back helps loosen up that tendon and those muscles to make sure the patient retains that quality of movement. But we don't want to scrape that heel against the sheet while we do this. So we're going to lift the heel up off the bed and then bend it forward and back so it's not scraping against the sheet. So that's the whole skill. That's it. We're going to bend the knee to the chest and back down to the bed 3 times, lifting from below with a flat palm. We're going to lift the leg and bend the foot forward and back 3 times, lifting from below with a flat palm. We're going to do our opening in the beginning and our closing at the end. That is the entire skill. That's it. So this is an easy skill. If I was picking my skills for the state exam, this would definitely be one of them. So if I can get somebody to go over there and lay in that bed, I'll show you what this one looks like. Thank you. Okay, so I'm going to do this entire skill from beginning to end, and I know you can't see his head, but that's okay. I actually do need to move that a little bit, though. Hold on one second, because you need to be able to see his ankle. Give me 1 second here. Oh, okay. I'm not sure where we were. All right. Okay. So I'm going to go back to the first screen because I don't have a wide enough view so you can see his ankle. So we'll go over this way. Can I get you to move that black cup real quick? All right. That should be good enough. All right. So this is my first skill for the state exam. That means that I have to wash my hands. So I'm going to do this entire skill from beginning to end, including hand washing. Here we go. Hi, Mr. Jones. My name is Patty. I'm your CNA today. How are you?
Okay, how are you?
Fantastic. I need to do some exercises on your right hip, knee, and ankle. Is that okay? I'm going to close your curtain. Let me go wash my hands, and I'll be right back. I got to move this supply shelf. There we go. Let me go wash my hands. So I'm going to turn the faucet on, wet my hands, get some soap, start to rub together, and look at the clock. So I'm going to rub the tops of my wrists, the backs of my hands, in between my fingers, in between my thumb and index finger, both sides, the bottom of my hand by my pinky, both sides, and the palm of my hand interlacing my fingers. And that is 20 seconds. I'm going to go down each one of my nails with my thumb. I'm going to circle my nails on the palm of my hand. And then I'm going to rinse. When I'm rinsing, I don't want to touch the sink or the faucet. And then I'm going to tap to keep the water in the sink. I'll get some paper towels. We're going to dry all surfaces that are clean. We'll throw that away, get a clean dry paper towel, and turn the faucet off. Okay, Mr. Jones, I'm going to do all the work. All you have to do is let me know if there's any pain or discomfort as we do this, okay? First thing I'm going to do is bring your knee up to your chest and back down to the bed like you're walking upstairs. Now, a word on bed height really quickly. I'm short. I don't really have to bend a whole lot. Most of you guys are taller than me. If you want to raise the bed up to a comfortable working height, you can, so you don't have to bend as much. But it's not required for Prometric testing. If you raise the bed, what do you have to remember to do? And at the end of the skill, you're going to be in such a hurry to finish that you may forget. So just be aware, if you decide to raise the bed, you must remember to lower it. All right, Mr. Jones, I'm going to bend your knee to your chest and back down to the bed. And we're going to do this 3 times. So I'm going to go from below, supporting at the joints. We're going to bend that knee up and all the way back down. Feel okay? Any pain? 2, all the way back down. 1 more. Up, all the way back down. Good? All right, so now I'm going to move down to your ankle. We're going to bend that foot forward and back like you're stepping on a gas pedal. I'll do all the work. So I'm going to lift from below. I'm going to push forward and then back. Feel okay? Forward and back. Still good? Forward and back. Good? Are you comfortable?
I am.
Is there anything else I can get for you while I'm here?
No.
Would you like a magazine before I go?
I'm okay.
Environment's clean. Bed's in the low position. Call light is right there. If you need anything at all, please let me know. I'm going to open the curtain and go wash my hands. So you can see the majority of the skill is spent over here at the sink. So I'm going to turn the water on, wet my hands, get some soap, start to rub, look at the clock, tops of the wrists, the backs of the hands, in between the fingers, in between the thumb and index finger, both hands, bottom of the hand by the pinky, and the palm of the hand interlacing those fingers. And that is 20 seconds. Move down to each one of my nails. Circle the nails on the palm of the hand. And then rinse, being careful not to touch the inside of the sink or the faucet. I'm going to tap to keep the water in the sink. Get some paper towels and dry what's clean. We'll throw these away. Get a clean dry paper towel to turn the faucet off. And then I want to think about the steps of my skill. So let's think about this for just a second. I'd probably review that care plan one more time. Care plan told me to perform the following exercises on the resident's right hip, knee, and ankle, flexion, extension. Did I do that? It tells me to provide 3 repetitions of that exercise. Did I do that? Okay, so I've done my care plan. I've thought about my principles. I did my opening. I did my closing. I'm pretty happy with my performance. So now I'm going to tell the evaluator my skill is done. Thank you. Good?
So we need to talk while we are performing our skills.
Yes. So let's talk about that. A question I get asked all the time is, do I have to say everything you say during the test? It's probably the most common question I get. And the answer is you should. Remember that I am teaching you. That's why I'm saying everything that I say, because you don't know how to do the skills, right? You're here to learn how. Do you know who else doesn't know how to do the skills? The patient. So if you're doing something on a patient, shouldn't they know what you're doing? Does that make sense? Okay. So imagine for a second being the patient. You're in a strange place, surrounded by strange people.
It's comforting, actually.
And most of them are there to hurt you. Think about that. Medicine is not comfortable. Nurses start IVs, phlebotomists jab you with needles, EKG people put these sticky tabs on and pull out every hair you never knew you had. x-ray people, put you on these hard tables in impossible positions. Medicine is not comfortable. So when you walk in that room, they're automatically going to think whatever you have planned for them is probably not comfortable too. So when you're giving them this information, I'm going to lift your knee up to your chest and back down to the bed like you're, climbing stairs. They know what that is. And that will immediately put them at ease because, hey, yeah, I know what that is and I can do that and that doesn't hurt. Good? Does that make sense? So you should say everything I say to the patient. The other reason that you want to do that is because when you're performing those skills, remember those evaluators have to check off that checklist. So they watch you do a step and then they have to look down here to find the step to check it off. That means that there's a small fraction of time that they're not looking at you. Does that make sense? If they hear you say the step, even though they don't see it, you can get credit for it. So, yes, you should say everything I say for the patient, but also for the test. Now, there's one other reason that you should say everything I say. When I was over at the sink and I washed my hands those 2 times, you heard me say the exact same words. You can go back and replay it. I use the exact same words in the exact same way. Now, what that's doing is forming a memory loop in your mind. So when you go over and wash your hands, you're actually going to hear my voice saying those same words. When you say it out loud, exactly like I've said it, that reinforces that memory loop, and you are less likely to forget a step. So by saying it out loud, you're also helping you. Good? And you'll see that everything that I do in here, I say the same way to help reinforce what you're learning. Okay, good? Any questions on that? Okay. All right. Okay, Rosie, let me send the, okay, so Rosie got the ebook. Jen says, that would be my biggest piece of advice, to say everything you do out loud. It makes it easier for you to think and the evaluator to know what you're doing. And this is somebody who just passed the test. So do you have to say the environment is clean to the evaluator? No, you don't. You don't. But I want you to think about that. So I'm going to say it. I would. How you see me doing the skills in here is exactly how I do them on real people out there. Everything I say is exactly what I say out there. All right, so let's move on to page 96, Denture Care. All right, when we're looking at this page, it'll tell you the principles down the side that we're going to be applying to this skill. Skill rules, because we follow the care plan. Opening, because every skill starts with the opening. Glove rules. Glove rules. Because every skill we evaluate glove rules. Barrier rules, because we have supplies. Linen rules, because we're working with linens, specifically towels here and washcloths. Basin cleaning, because we're going to have a basin that needs to be cleaned. And the closing. So nothing really to learn here. We've got some skill-specific steps we're going to get into in just a minute, but I want to bring your attention to the bottom of the screen. This is test-specific information. So somebody with your level of experience should be able to do this skill in 13 minutes or less. That's an insane amount of time, guys. They overestimate. Don't rush. But if you look at the next spot there, it tells you that you might be a patient for this skill. And we do not expect you to run out and get some dentures before you go to the test. So how does this work? Let's go to the care plan. Oops. Let's go to the care plan at the top of page 97. Our care plan says a resident with dentures is sitting at an overbed table with their dentures in a denture cup. So where are the dentures? Are they in their mouth?
No.
Are you taking dentures out?
No.
Okay. The resident's denture needs to be brushed with toothpaste and the resident needs mouth care. The denture is stored in a denture cup after cleaning. So after we clean, where do we put it? Do we put it in their mouth?
No.
This is why you can be a patient for this skill. There will be no dentures in your mouth at any point during this skill. Got it? Now that's important for us to understand at a more fundamental level because CNAs do not take dentures out and CNAs do not put dentures in without additional training. There's two reasons for this. When you have dentures in, those dentures are usually held in place by denture paste, or now they're held in place by metal posts that they snap onto. They're called mini implants. So either way, those dentures are pretty securely in the patient's mouth. Now, if I had dentures in order to get them out, I would have to put my fingers all the way to the back, way back here, and pop those bottom dentures up or pop the top dentures down. Make sense? To get them to dislodge. Everybody good with that? Okay. Here's where the problem is. If I'm putting those denture or those fingers in my mouth, I'll never put too much pressure on my bottom jaw. Physics being what it is, I wouldn't ever put too much pressure on that bottom jaw because it's my fingers in my mouth. But if I put my fingers in your mouth, in order for my fingertips to press up, that means that these two joints right here have to press down for leverage. And these two joints pressing down for leverage can dislocate a jaw. So removing somebody's dentures has a high risk of jaw dislocation without additional training. Good? Make sense? Now, you also don't want to put dentures in somebody's mouth, and that's because when dentures go in the mouth, the patient has to bite down to seat those dentures. It's automatic. They will automatically press their jaws together to get those dentures in the right place. Well, if your fingers are in the mouth, what are they biting? And they may not even realize it because it's a reflex. So CNAs don't put dentures in. And they don't take dentures out. So if your patient can't do that themselves, we don't give them dentures. We puree their food. Chop it up real fine so they don't have to chew it. Good? Yeah, it depends on the diet order. It could be mechanical soft, which means like mashed potatoes, scrambled eggs, right, applesauce, things like that. Or it could be pureed, which would be meats and vegetables that are blended up and kind of, it's not baby food consistency, but it doesn't require that chewing either. Okay, so it depends on the diet order. Good? Make sense? Okay. So we have step-by-step instructions here on page 97. It tells you exactly how to perform this skill. At the bottom of the page here, you'll see all of the supplies. And guys, there's a lot of supplies for this skill. There's a lot of supplies. You do have to learn your supplies. So if you've not made flashcards yet, this is a good time to consider getting some flashcards made up so you can learn those supplies. Okay? So for denture care, we're going to clean both the dentures and the mouth those dentures came out of. It's important to remember that we don't touch dentures without gloves. You can touch a denture cup, but you don't touch dentures without gloves for two reasons. The first reason would be just the ick factor, right? These things have been in somebody else's mouth. It's got food particles and saliva. That's a pretty big ick factor. It falls under our glove rules. But the other reason is for infection control. Because if you're touching these dentures with bare hands, your bare hands may have touched other things. So we don't want to transfer pathogens onto the dentures either because they're going in the patient's mouth. So good? We don't touch dentures without gloves. Now I'm going to break my rule and show you this real quick. So when it comes to dentures, there's actually 3 different types of dentures. And I want to show you this because most people aren't familiar with the different types of dentures. So the first type is this. This is a full plate. This is what we're mostly used to when we talk about dentures. It's going to look something like this. Dentures are always stored in water so they don't become brittle and break. So this is a full plate, right? Has all of the teeth. They're in gums, a gum material, and it's going to have a channel that fits over your gums. This is a full plate. This is what we're used to thinking about when we think about dentures. But not everybody needs a full plate. If the patient still has some healthy teeth of their own, we're not going to pull those healthy teeth out of their head. What we would do is make a partial. We would just replace the teeth that are missing, that have been removed, and have cutouts for the remaining teeth. Now, partials usually have some sort of a hook or a loop to fit around teeth that still remain. Sometimes now you'll see them with posts because many implants are becoming, places for posts to fit in. Many implants are becoming very popular now. They fit a little more securely than regular dentures. So this would be called a partial. And then we have little pieces of denture like this, which are called bridges. Now, most of the time now, bridges are permanently affixed. They just are kind of cemented in. But in some of your older patients, you'll still see removable bridges. They're just like pieces of dentures. So dentures can come in a whole bunch of different configurations. Full plates, partials, bridges. Good? Dentures always have to be stored in water. Otherwise, they become very brittle. So we're going to clean the dentures, and then we're going to clean the mouth those dentures came out of. So this is this is mouth care with an extra step. So everything we did for mouth care, we're going to do again. But we're also going to clean the dentures. But when we do mouth care, we're not going to use a toothbrush. The reason that we're not going to use a toothbrush is because that denture paste that holds dentures in gets all bound up in those bristles, and it's really hard to get the bristles clean if you're not in a running water situation. So when we clean mouths that dentures came out of and our patient isn't at the sink, we use a little bit of a different device. This is called a toothette or an oral swab. You'll hear it called both things, but they're soft, spongy, solid surfaces. So this, because it's got like little tiny holes in it, it's going to grab that denture paste, but it allows us to swipe the paste and the food particles off of the gums, turn it a quarter turn, and now I've got a new area to work on. I can swipe, turn, swipe, turn, and then this is disposable. It gets thrown away. Good? Questions? Okay. So because we're cleaning both the dentures and the mouth those dentures came out of, we're going to use 2 separate sets of gloves. One for the dentures, and then when we go over to clean the patient's mouth, we'll get a clean pair of gloves for that, because you guys don't want gloves in your mouth that's dirty, right? So clean set of gloves. So when it comes to cleaning dentures, there's actually two different ways that dentures can be cleaned. There's the old-fashioned toothbrush and toothpaste, which our care plan told us we're going to use for this patient. Easy peasy. So we're just going to get a brush, put some toothpaste on it, and brush everything we see. There's also a denture tablet cleaning method. Now this, the denture tablet, is used much more often. And that's because toothpaste is abrasive. That toothpaste has little particles that scrub, but it's because it's abrasive. Denture material is not the same as your teeth. Your teeth is like bone. Okay. Dentures are more of a plastic type of material. So when you scrape this abrasive particle across the surface of the dentures, it can cause micro cracks to form. And micro cracks are great places for bacteria to hang out. So in most cases, we're not going to be using toothbrush and toothpaste. We would be putting them in a denture cup with fizzy tablets, let them sit overnight, and then just use a soft brush to brush off any remaining particles before the patient wears them. Good? But our care plan tells us for this skill, for the test, to use toothbrush and toothpaste. So when we're going to clean the teeth, the dentures at the sink, we're going to use a special brush. This is called a denture brush. It has two sides. It has a bigger side that looks like a toothbrush we would use on the teeth part of the dentures. The teeth part of the dentures. And then it has a smaller side right here that fits in the channel part of the dentures. You can see that here. It fits in the channel part of the dentures to clean out the channel. You could use this, but it's not going to fit as effectively. So denture brushes have two sides. Most of you guys don't have dentures at home that you can practice on. So our practice kits, I don't have one in here. The practice kits actually come with denture simulators and a denture brush for you guys to practice with. Let me pass these around. Okay. So denture simulator, toothbrush, and toothette. So this is the toothette that we talked about. It's a solid surface, spongy. They're supposed to be like mint flavored. They don't taste that good, but we use that instead of a toothbrush. So when we're going to brush the denture at the sink, we're going to prepare that denture brush before we ever get over there. We're going to get it wet. We're going to put some toothpaste on both sides, and then we're just going to lay it in that basin. We'll take it over to the sink, and it's just going to hang out in that basin while we get ready, because we got some work to do before we can actually clean the dentures. We don't want to lay that denture brush on the side of the sink. The side of the sink is not clean. That's why it needs to be in that basin as a clean place to just hang out. When we're cleaning dentures, they become very slippery. First of all, they get saliva and food particles. They're under running water, and we've got gloves on. And now we're adding in toothpaste, which is kind of slippery. So they are likely to fall out of your hands while you're doing this. So we want to create a soft surface for those dentures if they should fall. We're going to put a washcloth in the bottom of the sink to create a softer surface. If we can get that washcloth over the drain and that water kind of pools up a little bit, that's even better, because if the dentures fall, then they hit the water, which is a soft surface, and just kind of gradually fall to the bottom on the washcloth. So washcloth in the bottom of the sink. We're going to turn cold water on. For dentures, we use cold water, not hot. There's a nursing principle: heat coagulates proteins, which I know means nothing to you. What it means, though, is that because we've got a lot of food particles and saliva, which has protein in it, it's going to make those things harder to remove. It makes them stickier. Well, we don't want to make this harder on ourselves. So cold water is best. We want to use a paper towel to turn that faucet on. And then once we get that water running, we can put our gloves on and get our denture. And then you're just going to brush what you see. Remember, the first thing your gloves should touch is the patient, or in this case, what came out of the patient, the dentures. Don't put your gloves on and then turn the water on. Do you guys understand why?
Yes.
So we're just going to brush everything we see. The top, the bottom, the groove, the teeth, the palate, everything you see. But be careful not to drop those dentures. Don't set the dentures down inside the sink. You need to keep them in your hand or in the cup. You can't just lay them in the sink. And then once you get them cleaned and rinsed, we need a clean place to put those dentures. So we'll dump the water out of the cup, rinse it out, get some clean, cool water in there, and then the dentures can go back in the cup. Remember, dentures always have to be stored in water. Good? Questions? Now that cup's going to be wet. We've just dumped water out of it. We've rinsed it out. That cup is going to be wet. Do I want to put a wet cup on this table surface? No, because it'll warp the wood. Do you think housekeeping is going to be happy with you if you go around warping their furniture? So when you clean the cup and you put the dentures back in the cup and you put the lid on it, we have to put something underneath that cup as a coaster before we put it back on the overbed table or the bedside table. It has to be on some sort of a coaster. Good? Questions? All right, once we get the dentures back where they belong, remember our care plan told us to store the dentures in a denture cup with water after the skill, so we did that. Now we can get rid of our washcloth, put it in dirty linen. We can remove our gloves. We're going to bring the basin holding that denture brush over to the table, remove our gloves, get our toothette ready for mouth care, and then put our mouth care gloves on. This is the hardest skill for students to remember because we have a glove change in there. And a lot of students always wonder, well, when do I change my gloves? Remember, the first thing your gloves should touch is the patient. If you remember that, it'll tell you when to put your new gloves on.
So when you got finished brushing the dentures and you picked up the cup with your other hand, that was still soiled because you were washing the dentures, right?
Right, and the basin that's holding the denture brush is also soiled, but we're touching it with our gloves.
Okay, but then you put that cup back on the table and you pick it up to clean it again?
Okay, so remember I said that we can touch the cup without gloves, but we have to have gloves on to touch the dentures, right? Okay, so we're going to go over this in just like a half a second, but let me help you understand this. If you look in your book on page 97, read step, I think it's 3. What's step 3? What's 4? 5? There it is. Okay, so we know that that denture cup is not clean. Patients touched it. We've touched it. It's not clean. So the paper towel that's under it is what we're going to touch. We're going to bring it over to the sink. And then, right. Good. Okay. Great pickup. That was good for infection control. Great pickup. So I want you to remember this principle. The first thing your gloves should touch is the patient. Okay. If you can remember that, it tells you when to put your gloves on, and that's what's graded for this skill. The rest of it isn't going to count against you. The first thing your gloves should touch is the patient. That's the graded checkpoint. And then we're just going to brush whatever the patient has. their gums, their teeth, whatever they got. Top, bottom, front, back, tongue, just like we did for mouth care, but this time we're using that tooth vet instead. We'll leave the patient's mouth clean and dry, and then we'll go clean up all of our equipment, just like we did before. Any questions on that one? A lot of steps, and this is a longer skill. It's 13 minutes. Now, the video does not take that long. Does not take that long. And I am going to show you the video because my top-down camera isn't working. I'm actually ordering 2 new cameras around Black Friday. So I'm really excited. I'm doing the research. But I have one that's coming that will be a follow me camera. So I'm super excited. Yep, my television studio is going to get an upgrade.
Hello.
Hi, Mr. Jones. My name is Patty. I'm your CNA today. How are you?
I'm doing good. How about yourself?
Wonderful. I need to do denture care on you. Is that okay?
Yes.
I'm going to take your dentures to the sink. I'm going to close the privacy curtain and wash my hands. I'll be right back.
Okay.
Okay, Mr. Jones. I'm going to place a barrier on the table so we have a clean area to place the clean supplies. And then I'll gather the supplies that I need. We'll need a cup of water, a toothette, a denture brush, toothpaste, a basin, a washcloth and a towel, and 2 sets of gloves. Okay, we're going to get the denture brush ready for use, so I'll wet it and apply a little bit of toothpaste to both sides. We'll allow the basin to hold that denture brush until we're ready to use it. I'll be right back, Mr. Jones. I'm going to go clean your dentures.
Okay.
I'm just going to brush all surfaces, keeping the denture over the sink, but keeping it in your hand at all times.
It's great, really, it's great easy for Watson.
Well, for the test, as long as you have the washcloth there, it's not going to count against you. As long as you have the washcloth there.
And it's not that they know list of supplies that you need or you supposed to memorize.
You have to learn them. That's why I was telling you probably need to make flashcards.
Right.
Because you need to learn them. And there's a lot of supplies for this one. Yeah. So you know when we did the review and that we reviewed all of the skills, like the black part, Those are in the flashcards, the supplies are in the flashcards, and all the pencils are in with the blanks so that you have to fill in the blanks.
On those flashcards.
So those flashcards really are a very good comprehensive review of everything. Okay, Mr. Jones, I'm just going to set your dentures over here so that you have them if you should need them later.
Okay.
I'll place the denture brush on the barrier and now we'll remove these gloves. And we'll throw those away. Do you mind if I place a towel over your chest?
That's fine.
This will help keep your clothing clean.
Thank you.
We're going to prepare for the mouth care portion of this skill. We'll take the toothette and wet it. Apply a little bit of toothpaste to one area of the toothette and apply gloves. Okay, Mr. Jones, I'm going to brush all surfaces of your teeth now. So in a moment, I'll need you to open your mouth wide so that I can reach the back teeth.
Okay.
Okay, can you open your mouth? Thank you. I'm going to brush the back on the bottom and on the top, both sides. Okay, can you bring your teeth together, please? Thank you very much. We're going to throw the toothette away. And would you like to rinse? Very good. Would you like another rinse?
Yes, please.
Another rinse?
No, thank you.
Okay. I'm going to remove your towel and we'll place this in dirty linen. We'll throw away the disposables. And now I'm going to clean your basin. I'll be right back.
Okay.
I'll place the denture brush and the toothpaste in the basin and open the drawer with a paper towel to store the basin and other supplies. I'll remove the barrier from the table and we'll throw this away as well. Now I can remove my gloves. Mr. Jones, are you comfortable?
Yes, ma'am.
Can I get you a magazine?
No, thank you.
Is there anything else that you need?
No, thank you.
Your call light's right there. If you should need anything, just let me know. I'm going to open your curtain and go wash my hands.
Thank you.
After washing my hands, I'll think about the steps of my skill, make any corrections, and then tell the evaluator my skill is done. Okay. Questions on that? So a question here, do you have to say the environment is clean to the evaluator? No, you don't. You just have to make sure it is clean. I'm saying it to remind you that that is a step that needs to be performed or observed. But no, you don't have to say it. It's not a graded checkpoint. Remember that our practice kit has all of these items to help you practice. So if you're not practicing in here, you need to practice somewhere. So in here, we have the denture simulators. I've got denture cups. I've got toothbrushes and toothettes and, you know, all the things that you need to practice in here. But in your home, you probably don't have everything. one of the skills that we're going to get to coming up is ambulate with a gait belt. So the practice kit also has a gait belt as well. So this is $47.99 for you guys. On my website, I think it's $69.99. So you're getting a really, really discounted price on this up through graduation. So on graduation, the sale goes away for you guys. Those of you attending online, you got regular price. I don't have a discount for you guys. All right, so let's go to page 63. We're going to talk a little bit about energy conservation. We've spent a lot of time in this class talking about the changes of aging because most of our patients are going to be elderly. Let's face it, most middle-aged people or young people don't need help. You're pretty healthy. So it's as we age that, things start to go south on us and we need some help. So we've spent a lot of time talking about the changes of aging. And this is one of them that you probably don't think about all that often. So to understand this, we have to talk about the energy levels across the lifespan. So let's think about a 2 or 3-year-old, okay? Anybody ever see a 2 or 3-year-old? They're probably my favorite age range. I love 2 and 3-year-olds. They're so inquisitive. They get into absolutely everything because they're learning about the world around them. They're learning cause and effect. But they're also learning about emotions and how to get what they want. It's a really unique time frame, physically and psychologically. I love 2-year-olds. They will jump up and down for absolutely no reason. They do not need a reason to jump up and down. When was the last time you jumped up and down for no reason? Probably when you were 2. Now, if I win the lottery, I'm certainly going to jump up and down. I got a reason for that. But I'm not jumping up and down to get rid of excess energy because, quite frankly, I don't have excess energy to get rid of. Right? So what we need to understand is our energy levels are super high at around 2-3 years old. That is actually the highest energy level that you will ever have. Let's just go out 10 years. Let's go to a 12-year-old. 12-year-olds still have tons of energy. They can skateboard and they can play video games. And they got tons of energy. But you put that 12-year-old in charge of that 2-year-old for one afternoon. Who wins?
The 2-year-old.
2-year-old every time. That 12-year-old will go, Mom, can't they take a nap? I'm tired. Your energy levels have declined in that 10-year period. Now let's go out to 22. 22-year-olds still have tons of energy. They can shop till they drop and go out at night looking fabulous. But they still do not have the same energy level that they had when they were 12. Have you ever tried to explain to a 2-year-old why you don't have the energy that they have?
No, it just makes sense.
Do they get it? You can say it till you're blue in the face, but they're never going to get it because they never experienced it. They think that everybody has the same energy level they have, right? Let's go out a little further. Let's go out to 42. 42-year-olds still shop till they drop, but that's at like 3, and we're not going out tonight. Energy levels have declined. Now let's go out to 62. 62, we're putting our feet up before we make dinner. We're thinking about retirement because there's just not as much energy to keep up with all of our daily stuff as well as a full work schedule. So we're starting to slow down a little bit. So if we know that energy levels have declined through this lifespan, what do you think they're going to be like at 82? Tired all the time. Energy level is going to be very low.
But that's not for everyone.
Oh, I was going to say there are outliers for
There's
sure.
a lot of them.
Sure.
But
But I'm talking.
I got a lot of energy.
I'm just talking in general. Okay. In general, energy levels decrease across the lifespan. So even though you've got a ton of energy, do you still have the same energy levels you had when you were 20?
I don't know. I feel like
You're not going down easy, right? That's how I
it was
feel.
different when I was 20 opposed to what it is now. So it's very different. It's kind of like flip flop for me.
Okay, so it's different,
Mm-hmm.
right?
It's better
Okay, so
now.
let me lead you somewhere, okay? So let's think about the housing development across the street. Let's think about the housing development across the street. It's 55 and up, right? Lots of people driving around in their golf carts, playing golf, playing tennis, playing bridge, living independently. They don't need our help, do they? For the most part, they're living independently. So are these the elderly that I'm talking about?
No.
No. The elderly that I'm talking about are those that need our help. Now, why do they need our help?
Energy conservation.
Okay, so remember there are always outliers. And the ones that I'm going to focus on are the ones that we are there to assist. If they don't need our assistance, that's not really our target audience. Does that make sense? My best friend's husband's grandma, I know it's right. My best friend's husband's grandma was in her 90s, and she took care of her great-grandson every day. She drove, she did all of the grocery shopping, and she was 98 years old. She did not need help. She did the grocery shopping, she did the cooking, she did the laundry, she took care of her great-grandson. She wasn't on this graph because she didn't need our help. Does that make sense? Now, my grandmother in her early 80s needed help. So everybody's going to be a little bit different. But my point is that generally speaking, when we're talking about our patient population, your energy level is going to decrease throughout your lifespan. But just like when you try to explain to a 2-year-old why you don't have the energy they have, so you're trying to explain to a 2-year-old why you don't have the energy, but they've never experienced that drop in energy, so they don't get it, right? This person is trying to explain to you why they don't have the energy to do what you want them to do. Are you going to get it? Probably not. Unless you listen to this lecture.
Right. Now I do.
You probably wouldn't get it. And part of what happens, because, our mindset's kind of like that 2-year-old. We never experienced that. And this is how the conversation goes. Miss Molly, would you like a shower? Oh, no, honey, I don't have the energy for that. What do you mean you don't have the energy? All you got to do is sit there. I'm doing all the work here. All you got to do is sit there. I'll bathe you. And she says, no, I don't have the energy. And you're like, what do you mean? Remember, you have energy reserves that they don't possess. Got it? So you, in that situation, don't truly understand the lack of energy that they have. Good? So why does this matter? Well, if this is all the energy that this person has to get through their day, if this is it, right? They got this much energy. We have to think about all the stuff they have to do with that energy. So what are some things that you do on a daily basis that requires energy? Okay, showering.
Healthcare.
Getting up out of bed.
Getting out of bed takes about half of my energy every day. Yep, I like my bed. I got a little tiny doodle that cuddles up next to me, and she's just the sweetest thing, and I don't want to get out of bed, right? That takes like half of my energy. What else?
Walking around your house.
Okay, walking. Sure, that takes energy. Motion. Huh? Going to work takes energy. What else?
Using the bathroom.
Ah, toileting takes energy. Absolutely. If you've ever been sick and have no energy, getting to the toilet can be a monumental effort.
Preparing food.
Okay, preparing food. Let's go a step deeper though. What about eating food? Does that take energy?
And cleaning.
Have you ever been too tired to eat?
No.
Okay,
Unless you're sick.
right? Unless you're sick and you have decreased energy. Absolutely. Have you ever been too tired to talk?
Yes.
If you have been too tired to fill in the blank, it means whatever that fill in the blank is takes energy. You guys see that? Everything we do every day takes energy. Everything. Even breathing takes energy. Digestion takes energy. Maintaining your body temperature takes energy. Remember we talked about room temperature always wins. So if all of these things take energy, and we only have this much energy to get through our day, you can see how sometimes older people can run out of energy before they run out of day. So that means that their evening meal, they may be too tired to eat tonight. And they just say, no, I'm just not hungry. Or they may be too tired to attend an activity, which will affect their socialization and can affect their mental outlook, lead to depression. They might be too tired to bathe at the end of the day. So we need to understand that all of these things take energy, and your patient isn't going to have the same energy level that you have. So what was your question?
I forgot. I'm good.
All right. So everybody got that? You got that? All right. So here's the real problem with this. Okay. When we put this together with all the other changes of aging we talked about last week, remember all those changes of aging? Thinner, drier skin, decreased muscle mass, decreased bone density, cognitive decline, right? We put all of those things together that lead to aging individuals that will need our help. We can start to see that everything that we do is going to matter here. Everything we do, including when we do things. And let me explain. How many of you guys are morning people? Do I have any morning people here? You function, you get up early, you function really well in the morning. Okay. So those of you who are morning people, you have a routine that is completely different than those of you who are night people. Who are my night people? Yeah, I'm a night owl. I'll raise my hand here. I'm not a morning person. Your daily routines are going to be very, very different, including when your energy levels are the highest. As a night person, you try to get me to do anything in the morning, first thing, and I'm probably going to be kicking and screaming and saying, I'm not ready for that yet. Okay. So we have to understand that circadian rhythms, or our own personal rhythms, are going to play into this. If we have somebody who showered every morning to wake themselves up, and they're now in a facility and you have them on the night side shower schedule, do you think that they are likely to get on board with that? No. They may say, I'm too tired for that, because their energy levels were higher in the morning and they relied on that shower to get them going in the morning. So do you see how personal preference might play into this? It also is going to affect the patient's food intake. Because if you remember, we talked in chapter 4, about the stomach size decreasing, the digestion slowing down. So when we have somebody who has higher energy reserves in the morning and they have a smaller stomach and decreased digestion speed, they may want their bigger meal earlier in the day, lunchtime, and then at nighttime they just pick a little bit. That might be perfectly normal for them. Where for you, you eat your bigger meal in the evening. So are you starting to see that how we look at life may be a little bit different than how our patients are going to look at life? Okay, does that make sense? So we have to be careful not to bring in our preconceived notions that everybody is just like us. And if our patient says, oh no, I'm too tired for my shower, maybe we can look at rearranging the shower time.
Or asking them, when would you like to take a
Sure.
shower?
Absolutely. Find out their
Communicate with them.
preferences.
They're just not, talk to them a little bit.
Right? Their preferences,
Sure.
correct. But there are some things that we can do to help our patients conserve energy as we go through our day. So let's think about this for a second, right? Let me show you guys something. Have you ever seen an older person trying to get out of a chair?
Yeah.
It kind of looks something like this. Okay? A younger person getting out of a chair just stands up. Not a whole lot of energy required there because we have strength. But an older person doesn't simply stand up out of a chair if their strength has been affected. It looks something like this. Oh, no. How much energy did that take?
A lot.
A lot. So now let's think about that for a second. They have decreased strength, so that requires more energy to get up. Okay, good? Makes sense? There's an inverse relationship between strength and energy. Okay, so if we have somebody with decreased strength that requires a lot of energy to get out of the chair, let's think about how many times they have to get out of the chair. So they have to get out of bed. Then they have to get into the bathroom and get off the toilet. Then they have to get back to their room and have a seat until breakfast. And then they have to get out of the chair to go to the dining room. And then they sit and eat, and they have to get out of the chair to go to an activity room. And then they sit there and they have to get out of the chair to go back to the bathroom. And then they go to bed and they lay down for a nap, and they have to get out of the bed to go to the bathroom. And then they have to get off of the toilet to go to lunch. Are you starting to see how much energy that's going to take? And we've only made it to lunch. So we have to be careful to think about energy in a little bit different way than how we look at ourselves. Good? Does that make sense?
Yes.
Okay. So, if our patient has decreased strength and that requires more energy, what if we could loan them some strength? If we could loan them some strength, they wouldn't have to expend quite so much energy. Does that make sense? So how do we do that? How do we loan somebody some strength?
You use a gate belt.
That's exactly what we're going to do. We're going to use a gate belt. So a gate belt is a flat canvas belt with a metal buckle on it that we put around the patient's waist, not our waist, the patient's waist. And we use this to lift our patient up to a standing position by using some of our strength to offset their weakness. Good. So that way they have to expend less effort. And that little bit of energy they have can be conserved. And we call this energy conservation. So we have to learn how to use a gait belt properly. Gait belts are just flat canvas belt. Does not matter whether the buckle goes this way or the buckle goes this way. Nobody cares. What matters is the tag goes inside like every other article of clothing. So when you put this around the patient's waist, I'm going to show you on me, but when you put this around the patient's waist, you want to put it around so it remains flat. It doesn't twist. It's got to remain flat. So you put it around their waist so that it remains flat. And then, oh, I don't have my, sorry guys. Well, just put this here. You should be able to hear me. Okay, so when you put this around the patient's waist, the free end goes through the first guard by the alligator teeth, just like this. Goes through the first guard by the alligator teeth. And then we pull it the way the teeth are pointing. See how all the points are going that way, pointing that way? So we pull the belt that way. If we try to pull it this way, it's not going to tighten. We have to pull it that way. And you want to get it snug. You should only be able to fit 4 fingers between the belt and the patient. If we have this on too loose, when we go to lift the patient, it can go up underneath their breasts, under their arms, or they can slip right out of it. So you want to make sure that it stays in place during the lift. So we're going to pull it so that it's snug, only fit 4 fingers. And then we're going to lock it in the second guard, and that keeps it from unraveling. This tail, if it's hanging down in your way, just tuck it into the belt. So this now is around our patient's waist, and it's going to help us lift them. Now, some people try to lift patients using their arms. If you try to lift somebody using your arm or using their arms, you're pulling on the top half of the person. Most of our weight is centered in the bottom half of us. If we're pulling at the top half, that means we have to hold more pressure to get that weightier bottom half to come along. It's trailing behind. Does that make sense? Where when we use the gait belt around their center, it's going to help us lift the patient to a standing position at their center of gravity. The other reason you don't want to grab somebody's arms is when you're lifting them, your hands can get into their muscles and their skin, and it can cause bruising and skin tears. So the gait belt's a much better option. So we put the gait belt around our patient to lift them at their center of gravity. After we've used the gait belt and we want to remove it, you take it out through the second guard and you hold this tail. Now we're going to slide, instead of trying to pull the tail, which we did when we put it on, this time we're going to hold the buckle, move the buckle. We move the buckle along the gait belt. So to put it on, we hold the buckle and pull the tail. To take it off, we hold the tail and pull the buckle. And then we take it off. Now, when we take this off the patient, we don't want to slide it. Listen closely to this sound. Can you hear that?
It was an abrasion.
That is, yeah, it's right against my clothing or my skin, and it can cause a burn or an abrasion or tear their skin. So we never pull against the skin. We either bring our hands around to get the gait belt and remove it, or you can loop it up and over, keeping that buckle in your hand so it doesn't hit their head, obviously. But you don't want to slide it against their skin. Good? Make sense? Okay, so for this skill, to learn this skill, we're going to come back here in just a second. But to learn this skill, you can see that all of the principles that are going to govern this skill are listed along the side. We have our skill specific here, and all of the principles are spelled out here. Now, the one that we have to learn is shoe rules. We've learned a little bit about shoe rules, but we haven't learned everything we need to know. So this is the last principle that we have to go over after today, Everything you need to know to do all skills is going to be covered. We're just going to recycle. So let's go over the rest of shoe rules. Now, we learned the first two. We learned it with foot care. Remember, when a patient's feet hit the floor, we have to talk about their shoes, and slipper socks are not enough. Page 67 gives us our step-by-step instructions along with the care plan at the top of the page. Care plan says ambulate the resident at least 10 steps. Use a gait belt or transfer belt. Patient will be sitting in a chair at the side of the bed with shoes on. So that means for the test, we don't have to put their shoes on. They're already there. But we do have to talk about them. I see you have shoes on. Are your shoes tied well? Do your shoes fit appropriately? We have to mention it in some way. Patient is able to walk, but needs assistance to stand. So this is exactly what we were just talking about. Somebody who is a little bit weak and needs some help standing up because of decreased strength. But they can walk once they're up and going. All right, so the rest of the rules that we have to learn here are listed under shoe rules. So 4 fingers between the gait belt and the patient. We just talked about that. Feet must be flat on the floor. Count to 3 before lifting. Ask if they're dizzy or weak after standing. The patient must feel the chair behind them before sitting and use proper body mechanics. We're going to go through each one of these. Remember that slipper socks are not enough. You cannot walk a patient, or you should not walk a patient just in slipper socks. So this is how we check that gait belt. We're going to put it on. We're going to secure it in the first guard. We're going to pull it so that it's tight or snug. And then we're going to slip 4 fingers down. We shouldn't be able to fit any more than that. The evaluators need to see this step. They need to see it. And this is every time you put a gait belt on. 35 years from now, if you put a gait belt on somebody, you should still be checking it with 4 fingers. Remember I said that in most settings, CNAs are not allowed to document in words? You guys remember me saying that? In settings that do require that you document in words, this is actually a legal principle. If you put a gait belt on a patient, you have to document that the gait belt was checked with 4 fingers. It's a requirement. This is one of the reasons that CNAs usually don't document in words. All right, so once we have the gait belt on the patient, before we try to lift them to a standing position, their feet have to be flat on the floor. And this is a problem for some of your patients. It's a problem for me. So let me show you what I mean. I know you guys at home can't really see this very well. I'll talk my way through it. But if I sit in this chair with my hips all the way back, my feet are not flat on the floor. I can barely, in fact, my leg is cramping. I can barely touch with my toes. My heels are not on the floor. If you try to lift me to a standing position, yeah, I'm not going to be steady. Now, just looking at me, if you just looked at me from here up, you would think that my feet are flat on the floor, but they're not. So before you stand a patient up, you've got to get their feet flat on the floor, and it's something you have to address. So for me, you would ask me, can you slide forward so that your feet are flat on the floor? Now, my feet are flat on the floor, and we can stand. You guys get that?
Now, how are you going to get them up from that position?
Okay. 1 second. I'm going to show you body mechanics next.
Okay,
Yep. So good. Everybody got that? Feet have to be flat on the floor. And you can't tell by looking at somebody from the waist up. You actually have to look at their feet. Good? Okay. And you have to verbally check this during the exam. That it's a checkpoint. Before you lift somebody to a standing position, you've got to count to 3. We have to make them a partner. So 1, 2, 3, we're going to stand. To help them stand, we have to use the right body mechanics. And this isn't what most people think it is. Most people think to help a patient stand, you stand in front of them. And a lot of places will teach you toe-to-toe, knee-to-knee. Well, there's a physics principle that makes this a real problem. If I've got somebody sitting in the chair, and I'm standing in front of them, toe-to-toe, knee-to-knee, and I bend forward to grab the back of the gait belt, and I lift them forward, do you see what happens to my body?
Yeah, you're straining yourself.
My torso is going to go back. Now, there's a physics principle here. Every action causes an equal and opposite reaction. Some of you may remember that from science class. You did learn it in 9th grade. So equal and opposite, what does that mean? Well, if I'm lifting somebody 150 pounds toward me, that means that my back is going to go backwards with 150 pounds of force. How long do you think your back is going to be able to keep up with that? Yeah, not long, which means that you're either going to end up with back injuries or you're going to become unstable and both you and the patient are going to fall. That's not safe. So we don't stand in front of somebody to lift them toward us because of that physics principle. Instead, we're going to use something called the box principle. So I'm going to put this camera down here. And let me show you what I mean. I know it's a little off center, guys. Okay. If I am sitting in this chair, those of you in here should be able to see this. Do you see the line in front of my feet? You guys see that line?
Yes.
Do you see the lines on either side? So I am sitting in a box. You can actually trace a box around me. So keep in mind a patient sitting here, their feet flat on the floor, and I've got this box around me because I'm going to use that for body mechanics. So when I've got a patient sitting there, I'm going to put one foot perpendicular across in front of their feet. The other foot goes parallel to the chair. I'm going to bend at the knees, not the waist. I need to keep my back straight. I'm going to grab the back of the gait belt, and on the count of 3, 1, 2, 3, we're going to stand. Now, if I do that, you'll notice my body did not get pulled off balance. Okay, does that make sense? It's actually easier than standing in front of somebody. It's easier. But you have to be taught to do it. It's not intuitive. Okay?
How do you do it if they have to go to, if they're being picked up from the wheelchair to their walker? How would you be in front of them like that in a box? Would you box the walker, and how would you do that?
So the walker.
The walker's right in front of the wheelchair.
Okay. So if I've got a patient sitting here, right? And I have the walker cage right in front of them, right? My foot is going to go inside the walker from the side. I'm going to reach around them. Their hands are here on or pushing that, but their hands, and then I'm going to help them stand
Pulling up from the back of the gate.
from this. Yep. Sides or back. Yep. It's the exact same motion. The only difference is instead of my foot just being in front, it's through the side of the walker. Okay. Good? Okay. Once we get the patient standing, we need to ask them, are you dizzy? I need to know here. I don't want to wait until we're over there. What's my exit strategy if I wait till I'm over there? If I say, hey, are you dizzy? And they say yes, what's my exit strategy? It's just you, me, and the gate belt. What most CNAs will do in that situation is try to hurry the patient back to the chair. You're never going to make it. They can't tolerate a slow walk. How are you going to have them rush? They'll never make it. And this is how most falls happen, is that CNAs panic. They try to get the patient back to safety, and they never make it. So it's better to ask here, how do you feel? Are you dizzy? If they say yes, have a seat. We're not going anywhere. It's not safe. You can prevent a lot of falls that way. But if I ask and they say I'm fine, and we get down the road a little and they say, oh, I'm not feeling good, what do we do? Well, you can't rush them back to the chair. We can't leave them to go get a wheelchair or something else. We're going to help them sit on the floor, because a patient that's sitting on the floor can't fall on the floor. And then we can go get other staff to help them stand back up. Get the nurse to assess them. We have other resources. But you don't want the patient to fall. It's all about fall prevention. So helping a patient sit on the floor is much safer. It's controlled. Whatever they come into contact with on the floor, we can wash off. We have soap and water. It's okay. We can't wash off a broken hip. Good? Good. So we're going to stand our patient up. We're going to ask, are you dizzy? We're going to walk them as far as care plan says, and then we're going to return to the chair. Now, once we return to the chair, we need to get them to back up so that their legs are against the back of that seat. So, if I have the chair here, and my CNA has walked me over here, and they get me to turn around, and I'm here, am I touching that chair? Do I know that chair is behind me? So when you try to sit me down, I'm automatically going to stiffen up and do one of these things, because I don't know if there's something behind me that's going to catch me. Most of your patients have been dropped. Most of your patients have been dropped. There is a trust dynamic here that you don't have. You're asking a total stranger to trust you when they have been dropped in the past. So the only way to get over that is to reestablish trust by getting them to back up so that they can feel that chair behind them. And then when you help them sit, they will sit. They're not going to fight you. Okay? It's really sad, but most of your patients have been dropped. All right. So we want to use proper body mechanics while we're lifting. We're going to bend at the knees, not the waist. Keep your back straight during this. All of these principles are going to be used in this particular skill, but there's one more that's not on here that we have to think about. During the test, this is the only skill that they're going to try to trick you. Actively try to trick you. During the test, when you do this skill and they're setting it up, they're going to move an obstacle in your way. And it will probably be a rolling table. They will, before you ever start this skill, they are going to put something in your path. Now, our care plan tells us to walk patient 10 steps. So it's 5 steps in one direction, 5 steps back. But for the test, they're actually going to give you a destination. They're going to say, I want you to walk to the desk and back. Or I want you to walk to that table and back. They're going to give you a destination because there's going to be an obstacle in your way on that destination. You have to remove the obstacle before you stand the patient. Because if you stand that patient up and then you leave them to go remove that obstacle, you have now created an unsafe situation. Does that make sense? It's the only skill that they're actively going to try to trick you. So watch out for those obstacles. Gait belts go over the patient's clothing. This should be self-explanatory. It really should. It really should. But unfortunately, it's not. Gait belts go over the patient's clothing. We were a testing center for many years, and one of the evaluators came out one time, and she was just like shaking her head going, I have seen it all now. There was a student that was practicing. She had obviously never seen a gait belt, didn't know how to use it, didn't know what to do with it. And first she put it around the patient's waist and then thought maybe that wasn't right. And then she put it around her waist and had the patient hold on to it. And then she stood the patient up and then tried to put it on. I mean, she did all kinds of stuff. But one of the things that she tried to do was pull the clothing up and put the gait belt around underneath the clothing. So I know it sounds very simplistic, but gait belts go over the patient's clothing, not yours, and not under, over the patient's clothing. I know. We want to hold the gait belt around the back and the sides, not the front. When you hold the gait belt in the front and you pull them, you're pulling them like this. Their shoulders are going to drag backwards. It's not going to be comfortable with them, for them, and it's going to pull them off center. And it increases the risk of falls. Do you see her body mechanics here? Do you see how her shoulders are backward?
Yeah.
You guys see that? When you're lifting a patient up, you need to ask them to put their hands on your shoulders, if possible, to get their torso to move as a unit. Otherwise, we end up with this situation, and again, even though you're on the sides or the back of the gait belt, the top half of the patient is going to trail behind. That makes them off balance and can increase the risk of falls. We're going to let the patient lead at their own pace. We'll walk slightly behind to one side. Our focus needs to be on the patient. I can't tell you how many times in my career I've heard a CNA say, well, we were just walking, I don't know what happened, and then she fell. That is not what happened. You were walking, she gave a sign, and you missed it. That's what happened. Patients don't just walk along, I'm good, I'm good, I'm good. It doesn't happen like that. Patients decompensate. They will get pale, sweaty. They'll put their hand out to the side. They'll put their hand to their stomach or to their head. They start to weave a little bit. They slow down. There's a million signs that things are going very wrong. And if you're not paying attention to the patient, you will miss every one of them. And then it's, well, we were walking, and the next thing I know, she's on the floor. That tells me that you weren't paying attention. So part of this skill is paying attention to the patient, not your cell phone, not another coworker down the hall, your patient, because they will always give you a sign that they're about to fall. It's your job to pick up on it. Good?
Yes.
Okay. You do want to monitor how they feel throughout the skill. Are you dizzy? You feeling okay? It's a short walk. We're only doing 10 steps. It's 5 steps in one direction, 5 steps back. This isn't a long walk, guys.
Okay.
So, just ask once during the walk. You feeling okay?
Are we gonna do role playing at
Yes.
some point?
I'm trying to get you guys practice time today. Yes.
Can we get a break?
I'm
Sorry.
Yes, but remember the break takes away from the practice time. Okay, so when we lower a patient to the chair, we want to control the descent using that gait belt. And then we'll remove the gait belt, holding onto that buckle. Check to make sure they're seated properly with the hips against the back of the chair. And then we're going to do our closing, give them the call light, opening the curtain, and all of that. Question I get asked a lot about this one is, do we have to close the privacy curtain for this since we're taking them for a walk? Yes, you do. You close privacy curtain for everything except for one skill we'll get to on Wednesday.
With the call light, when a patient's sitting on the chair, you can leave the call light on the bed.
So within reach. So for the test, the chair will actually be right next to the bed. So you can leave it right there on the bed. In here, I've got the chair moved out a little bit just so that you guys can see a little better. Okay? Good.
Yes.
Questions? All right. So let me show you this skill. I need a volunteer. Somebody go. Thank you.
Do you just want me to sit down?
Yes, please. Okay, here we go. Hi, Miss Jones. My name is Patty. I'm your CNA today. How are you?
I'm good. How are you?
Fantastic. Do you feel like going for a little walk?
Yeah.
Okay, let me go close your curtain, wash my hands, get my supplies, and I'll be right back. So we got an obstacle in our way. I know that the evaluator asked me to walk to this table and back, so I'm going to take a moment to move that obstacle out of my way. And then close your privacy curtain. This is my second skill the evaluator told me to simulate. I have clean hands. I've just washed them. I see you have shoes on. Do they fit well?
Yeah.
And are your feet flat on the floor?
Yes.
Okay. I'm going to put this gait belt on around your waist. This is going to help me lift you to a standing position, okay? And just lean over for me and relax. So this is the first guard. Make sure it's snug. Check with 4 fingers. Okay, we're going to walk over there, but I'm going to stand you up first. You have shoes on. You bring your feet together just a little bit for me. Thank you. I'm going to ask you to put your hands on my shoulders in just a moment, and on the count of 3, we're going to stand up, okay? Go ahead and put your hands in here. 1, 2, 3. Feel that stability?
Mhm.
Okay, go ahead and drop your hand and relax. Are you dizzy at all?
No.
You can lead. We're going to walk over there to the camera. Feel okay?
Yep.
Okay, go ahead and turn around, and we'll walk back to the chair.
Good job.
Feel okay?
Yep.
Okay. Turn around and back up so that you can feel that chair behind you. I'm going to help you sit. Put your hands back up here. And on the count of 3, we're going to sit. 1, 2, 3. And make a gate belt. Go ahead and get started. Thank you. All right. Are you comfortable?
Yes.
Is there anything else I can get for you while I'm here?
Thank you.
Would you like a magazine before I go?
Okay.
Okay. Call light is right here. If you need anything at all, feel free to press the button. Environment's clean. Open the curtain. Put my gate belt away. Wash my hands. My skill is done.
Good job.
Thank you. Any questions?
No.
I have a question.
Yes.
When you're lifting the patient with the gait belt, like when you picked her up, is there going to be lots of pressure on the patient's stomach when you're lifting?
There shouldn't be because you're on the sides.
Okay.
Or toward the back.
Okay.
Yeah. So you'll want to be a patient for this so that you can see how much pressure is actually exerted. How stable did you feel
It was stable enough.
with the lift and the lower?
Yeah.
Okay. All right. Any other questions? Questions? All right, let's go ahead and take our break. Only going to take a 10-minute break.
So you don't know what call out, I guess then be careful, because a lot of the, call outs are getting the cars that went underwater. One thing you wanna check is the floor mat, see if it's any water or if they're wet. I did drive the gas one the other day and all the windows were open in all the cars, and that's a sure sign. You know, you don't wanna get a bomb. So 4 minutes. Eventually you're able to fit, I think it was one. Okay, here's one for you. When the patient's feet hit the floor, we talk about their what?
Shoes.
Shoes. Nice. Okay, thanks. Before walking, make sure he is breathing. Obstacles.
It's not fun. It's not fun. You have to be careful. You see one of the first stuff like I had a resident.
Oh, and are they creepy? Is it like common that they're really creepy?
Oh yeah, I had one of my residents sock another resident because he was trying to touch me. Oh yeah, your residents, there'll be residents that are overprotective of you, and they keep it around. And then you'll have other ones that you're like, why am I over here? I had one to take care of. I'm not gonna make the rules. Why would you do that with Karen?
There's no way that's real.
I saw him do it.
No, I believe you.
This is the gate belt is like for nursing homes.
Okay. Are you gonna say where you're at now?
I'm working right across the street.
Oh, okay.
Timber Pines.
Okay.
They do not use that. And some people will be a 1-person lift or a 2-person lift.
Mhm.
That's because they don't have this or like the chair that'll lift them.
Yeah.
So yeah, if you're working in assisted living, good luck with your back.
I want to work at a hospital. Hopefully.
Worse because you get different types of patients.
No, exactly. It's not.
I prefer
I can't. And the book makes it sound awful, and she makes it sound awful, and she's like, there's still again.
The hospital you can range from gunshot victims to a simple cut on a finger. You get a wide, but for assisted living, you just get the ones that.
And it's all really bad every day.
No, you will have your good days, and then you'll have your bad days. It makes you like, I want to quit.
I do what I get, you know.
You'll have your days where you love your job, and then those days where you're like, can I just like, it's gonna happen. It's like every job. For my assisted living jobs, they're fine.
Yeah.
All right. Let's go to page 126, please. This is the longest skill that we have to perform the state exam. If you look down here, you'll see somebody with your level of experience should be able to complete this in 19 minutes or less. It is the longest skill. But that being said, there is nothing new. If you look at all the principles, we're going to follow the care plan. We're going to do our opening. We'll evaluate if we need gloves, and you will, because we're around wet body openings. We need a barrier to put our supplies on. Since we're working with linens, linen rules will apply. It's a skill where your patient's going to be undressed, so we have to use a privacy blanket. We have to turn our patient over in bed, so scoot and roll is going to be addressed. It's a washing skill. We wash everything the same way. Because we're washing, we have to clean the basin after we use it, and we're going to do our closing. You know all of these principles. We've gone over them multiple times, and we reviewed them this morning as well. So there's nothing here that should be confusing for you. Okay, we're just going to apply everything we've learned, with the exception of one small detail that I'm going to teach you, a cleaning method that I'm going to teach you that we're going to use anytime we're cleaning a wet body opening. But you know all of these. Good? Questions? It's a long skill.
Yeah.
So if we look at page 127, at the top of the page gives us our care plan. It says give the resident a partial bed bath and back rub. Wash the resident's face, neck, chest, abdomen, back, one arm and hand with soap and water. Provide a brief back rub with lotion. Dress the resident in a clean hospital gown after bathing. And patient is lying on back in center of bed and can roll as directed, but is too weak to assist with bathing. That's your care plan. It tells you exactly what to wash. Face, neck, chest, abdomen, side, one arm and hand, and back. Exactly what to wash. But we can simplify this, make it a little bit shorter to remember, by face to waist, front and back. One arm and hand. Okay. What if the patient has two arms?
It says one.
Says one, so we're only washing
One arm.
one. You get to pick which one, they don't care. This is a mannequin skill. Again, this is a time-saving measure. In most cases, you're going to be washing both arms. But maybe the patient is having a procedure done on one arm that's affected by soap. That is a thing, by the way. Maybe the patient has a cast on that other arm or an incision, and the nurse doesn't want you anywhere around it. There's a lot of reasons why our care plan might say one arm and hand. We're just going to follow the care plan. It also tells us to give them a brief back rub with lotion. This is not massage therapy. We aren't deep tissuing anything. This is simply a little back rub, very short, to open up the capillaries, restore blood circulation, and just make the patient overall feel a little bit better. Remember, cared for as well as cared about. Good?
Yes.
Super easy. A lot of supplies for this skill. You do have to learn your supplies. Remember, flashcards are your friend. There's also a lot of steps involved in this as well. But if you remember washing rules, we've gone over all of the washing rules except for one. Basins are no soap zones. We use the paper towel to turn the faucet on. We check the water. It should feel warm, not hot, not cold, just warm. The patient has to check the water. Whatever we wash, we rinse. Whatever we rinse, we dry. Don't get your surface wet. And warm the lotion up before we apply it, then wipe off the excess. We know all of those rules. We've heard them before, multiple times by now. But there's one that we haven't gotten to, and it's right here in the middle. And that one is that we use the leaves method for wet body openings. So a wet body opening, if you remember our lecture from infection control on day 3, we talked a little, or day 2 it was, we talked a little bit about portals of exit and portals of entry, right? And remember, those are all wet body openings. So eyes, nose, mouth, genitals, rectal area, wounds, rashes, sores, and incisions. If we're going to be washing a wet body opening, we want to use a special technique to minimize cross-contamination. So this is just a review of all those washing rules. Basins are no soap zones because we need water for rinsing. We use a paper towel to turn the faucet on. We check the water. It should feel warm. The patient checks the water. You're going to change it out if it gets cold or soapy every time. Whatever we wash, we rinse. Whatever we rinse, we dry. Change it out if it gets cold or soapy. Dry surfaces remain dry. Lotion is warm, then wiped off. We know all that. So let's learn the leaves method. Okay. So the way this works, please take one washcloth and pass it around. The way this works is we're going to use a special technique anytime we're washing a wet body opening. So, wet body openings, eyes, nose, mouth, genitals, anal area, wounds, sores, rashes, and incisions. But remember, our partial bed bath told us to wash the face. So, we have eyes, nose, and mouth on the face. That means because we're washing these areas, we're going to use a special process on the wet body openings. What does that mean? We have a plain washcloth, just a square washcloth. You guys probably have these at home in a linen closet somewhere. Most of us fold it in half and then in half again and put it on our shelf. And we look at them as squares. But instead of looking at it as a square, I want you to look at it as a diamond. Now, if you hold it in a diamond shape with the free corners up at the top, not the folded corners, the free corners up at the top, just like this, and you put it in your hand, tuck one side in by your thumb, the other corner in by your pinky, with the free corners at the top, we can wash a wet body opening and then fold that corner over. That traps the contamination underneath. Now we have a new cleaning surface to clean another wet body opening. We can fold that over, trapping the contamination underneath. We now have a new cleaning surface to wipe another wet body opening, fold it over, and a new cleaning surface, fold that over, and then the back side can be a new cleaning surface. So I have 5 independent cleaning surfaces on this one washcloth that prevents cross-contamination. This is called the leaves method because we use a leaf of the washcloth to fold it over. Good? Questions? Okay, so on the screen, I show how this works. We hold the washcloth in our hands. Remember, no drippy wet washcloths. You've heard me say that before. We hold the washcloth in our hand and we wipe using the first leaf. Then we fold that leaf over and wipe something using the second leaf. And then we fold that second leaf over and we wipe something using the third leaf. And we fold that third leaf over, wipe something using the fourth leaf. And we can even fold that fourth leaf over and use the back side to wipe something. So 5 independent cleaning surfaces. Pretty cool, right? You're going to see this again with peri-care and with catheter care. So we're going to use this leaves method with 3 skills that we learn how to do. But the first one that we're going to learn is partial bed bath. So Our care plan says, one more time, to give the resident a partial bed bath and back rub. Wash the resident's face, neck, chest, abdomen, back, one arm and hand with soap and water. So let's stop there for a second. The only part of this that has a wet body opening is the face. Eyes, nose, mouth. The rest of it, the neck, the chest, the abdomen, the side, one arm and hand in the back, no wet body openings there. So we can just use a regular washcloth and wash and rinse. We only need that leaves method when we're washing a wet body opening. So we're only using that leaves method on the face. Okay. Now, when we're washing the face, we don't want to use soap on the face because soap gets into the eyes, it stings the eyes, and it can dry out the skin of the face. So water only on the face. Good. Then it says provide a brief back rub with lotion. Dress the resident in a hospital gown. Patients lying on back in center of bed and can roll as directed. It is too weak to assist with bathing. So this is a mannequin skill. So no soap on the face. I'm going to take my washcloth. I'm going to wipe inner to outer corner on the eye. Fold that over. Inner to outer corner on that eye. Fold that over. I'm going to wash the rest of the face. Fold that over. And I always do the nose last because boogers. Yeah. And then we're going to set this aside. There was no soap on it, so I don't need to rinse. I'm going to dry all of those surfaces. Then I'm going to take a new washcloth, wring it out, put some soap on it, and I'm going to wash the neck, the chest, the abdomen, up the side, down the top of the arm, the hand, up the bottom of the arm, and armpit last. That just makes sense. Yes. And then I'm going to rinse all of those areas because whatever we wash,
You gotta rinse.
we rinse.
So we understand that the armpit is the last, but what if we mix around with the others? So like before doing the abdomen, you do the underarm and then do that.
It's
Does it matter on
fine.
the
It
scale?
doesn't matter on the test, but for your patient, I mean, the underarm really kind of is the stinkiest part. We probably don't want to spread that across the chest.
Okay.
You're not graded on it. You're not graded. It doesn't matter. But for me, if I were the patient and somewhere were bathing me, I probably wouldn't want my underarm funk on my tummy.
Okay.
Does that just kind of make sense to everybody?
So it says here for supplies there's 4 washcloths. Is that because you have to rinse, wash, rinse, and dry with 3 separate cloths?
Okay, so let me go through that because this is the one part that really messes people up for partial bed bath. 4 is the minimum that we need. You can use 5 for the state test. 5 is easier. 4 is the minimum. Now, why do I show you the minimum? Because when you go to work, wherever you go to work, chances are you are not going to have a stocked supply room. Unfortunately, so it's just.
They're trying to charge me $197 for car insurance. No thank you.
So you are probably not going to have a stocked supply closet. So that means that you're often going to have to do skills with fewer supplies than you would normally do them with. So I'm teaching you how to do this with 4 washcloths so that you understand the process of conserving supplies. For the test, you can use 5. 5 makes it super easy. You don't have to worry about what you can reuse and what you can't. But the rule of thumb here is if you don't apply soap to the washcloth and it didn't touch a wet body opening, you can reuse it. So if I have a rinsing washcloth, remember I don't apply soap to my rinsing washcloth. So if I have a rinsed washcloth that I rinsed under the neck, the abdomen, up the side, down the arm, if I have a rinsing washcloth, and remember it's only touching clean skin because we've already washed that area, we can reuse that washcloth. So our rule is, if you have a washcloth that you did not apply soap to, that did not touch a wet body opening. So could I use the washcloth, reuse the washcloth that I washed the face with? No, because it touched a opening. So if you have a washcloth that did not touch a wet body opening and does not have soap on it, you can reuse it. So our rinse washcloth, we can reuse. So I show you how to do this with 4 washcloths, but for the test, if you want to grab 5, so you're always using a clean washcloth, a new washcloth, that's fine. You can do that. So we have 1 washcloth for the face. We set that aside. We have 1 washcloth to wash the front that we put soap on. We set that aside. We have 1 washcloth that we rinse the front. We can reuse that if we want to, or we can set it aside. We need 1 washcloth to wash the back and 1 washcloth to rinse the back. So if you add all those up, it comes to 5. Or you could reuse your rinsing washcloth. Now, I don't want to set that rinsing washcloth off to the side if I know I'm going to reuse it because it's going to get cold. How comfortable do you think that is going to be for your patient? Probably not. So we would want to put it back in the basin. Remember, we didn't put soap on it, so it can go back in the basin.
So if we were in a clinical setting and, as you said, we have to follow the care plan, we go into the room and a patient asks that we use a certain type of face wash for them and this and that. Are we allowed to?
Who would we have to check with?
The nurse.
The nurse. Are we ever able to make a decision? No. So if that's a patient request, perfectly acceptable. No problem. But I would have to run it by the nurse because the nurse knows the treatments that are coming up for the patient and the medications the patient's on. So the nurse is going to be the best one to figure out whether there's going to be interactions.
Okay.
So we would just run that by the nurse. It would be as simple as, let me check with the nurse real quick. I'll be right back. Let me just make sure that that's cool. Okay. And if it's not, the nurse is the one that will come in and explain, hey, Mr. Henry, we can't use that face wash on you right now because you're on this medication and there's an interaction. It's their responsibility to educate. Okay, so good? So no soap on the face. We're going to use the leaves method around the eyes, nose, mouth. We always wring out our washcloths, no drippy wet washcloths. We're going to support the arm when we lift it to wash the arm. Remember, we always lift things from below with a flat palm and we provide support. We're going to put washcloths on the barrier when we're done using them, not on the floor. When we give the back rub, we wash, rinse, dry the back, and then we warm the lotion in our hands and give a very brief back rub. And when I say brief back rub, we're going to start at the bottom of the back, go up in small circles to the shoulders 3 times. 1, 2, 3. And then after we put lotion on, we wipe it off with a towel. Good. So even though this is a super long skill, it's actually pretty easy. You know everything you need to know to do the skill. Okay? Let's talk about the gown. This is going to mess you up. I told you this is an easy skill, but this is going to mess you up. You can do this any way you want to. Nobody cares. Nobody's grading it. Nobody cares. Nobody. But I want to lead you through this. Remember we talked about energy conservation a few minutes ago? And everything that we have that patient do is going to take a little bit of their energy. So if I turn a patient over, wash, rinse, dry their back, give them a back rub, put them back on their back, take their gown off, put a new gown on, I have to put them back on their side to tie that gown. And then back on their back. Do you see how much motion that requires? There is an easier way. When we are cleaning the patient, the front of the patient, take that gown off. Clean the front of the patient, wash, rinse, dry, put the new gown on. When you turn them over to clean their back and we're all done, you just tie the gown. It keeps us from having to turn that patient again. So that's how you're going to see me do it in the video. You're going to see me wash rinse and dry, put the new gown on, turn the patient over, wash, rinse, dry the back, give them a back rub, and then I'm going to tie the gown. It actually cuts about 2 minutes out of this skill. Now, if you want to get the whole body clean and then put the gown on, you can. But it will add time to the skill. It's already a long skill. Okay. Good? All right.
Excuse me.
Try the gown.
When you're
Go ahead.
when you're washing the face, right? You have to have gloves on because of the openings.
Right?
Okay.
Right. I also want you to keep those gloves on throughout the entirety of the skill because we are going to be washing the chest as well. And especially with females. You don't want to touch personal skin with bare hands.
Indeed.
Okay, so we're going to put the gloves on right before we start to wash because the first thing our gloves should touch is the patient. And we're going to wear gloves throughout the entire skill. We'll clean up our environment, so we're going to put our soiled linens into the hamper. We're going to clean our basin and put it away, gathering our supplies along the way. Then we can remove our gloves and remove the privacy blanket. And then we'll finish up with our closing. Good? Questions?
No.
Okay. So these are our steps that are required for this particular skill. I'm going to show you the video. The video is not 19 minutes. It's actually way quicker than that. And then you will have practice time. I just put the link for the ebook in the chat for you, Audie. Hi, Miss Jones. My name is Patty. I'm your CNA today. How are you? Good. I need to do partial bed bath. Is that okay? I'm going to close your curtain. Let me wash my hands, get my supplies, and I'll be right back. The evaluator will actually... For this skill, I'm going to need a barrier for the table. This will give me a clean place to put my clean supplies. For this skill, I will need 4 washcloths, 2 towels, a clean gown, and a privacy blanket. It's a washing skill, so I will also need a basin, soap, and lotion. And I'll need a set of gloves. Miss Jones, let me go get some water. I'll be right back. Miss Jones, is this water appropriate temperature? Okay. And now I'm going to spread the privacy blanket out over you. This will help keep you warm and protect your privacy while we do this skill. I'm going to spread the blanket without snapping or shaking the blanket. And I'm going to pull your sheet down to about your waist. Okay, Miss Jones, I'm going to ask you to sit forward for me in just a moment so I can untie your gown And I'm going to spread this towel out underneath you to keep your sheets dry while we bathe you. Can I assist you to sit up, please? Thank you. I'm going to untie your gown and spread the towel out on the bed. Go ahead and lay back down, Ms. Jones. Thank you very much. And now I'm going to spread the towel out underneath the arm. I'll remove the gown on the side closest to me, supporting the elbow as I lift it. And I'm going to relocate the gown to the other side of the patient. This leaves the patient uncovered underneath the privacy blanket for bathing. The blanket will keep you warm. Now I can apply my gloves. I'll take the first washcloth and wring it out. And I'm going to use 4 corners. We'll wash the face first, no soap on the face. Ms. Jones, I'm going to wash your eyes. I'll start with the closest eye to me. I'm going to wash from the inner to outer corner. Very gently. And then we'll fold this sleeve over to prevent contamination from spreading to the other eye. Ms. Jones, I'm going to wash your other eye now, inner to outer corner. We'll fold that leaf over, and then I'm going to wash the remainder of the face. Using very gentle strokes and keeping control over the washcloth. We'll fold that leaf over and use the final washcloth for the nose. And then we'll set that aside. I'm going to take the towel and pat dry all areas of her face, making sure not to use too much force. We'll set the towel aside. We're going to take the second washcloth and wring it out. And we'll apply soap to the top leaf. We do not need to use the leaves method because all of her skin from this point is intact. We're going to wash behind the ear, under the chin, across the neck, the upper torso. We're going to lift the blanket to protect privacy but keep the patient covered while we wash down to the abdomen and up the side. Now for the exam, you are going to make sure the patient remains covered until the evaluators ask you to remove the blanket. At that point, you will just continue on. I am going to repeat these actions so that you can see what I have done. I'll remove the blanket for better visualization. Behind the ears, across the chin, the neck, the upper torso, around the breasts, down the abdomen, and up the side. Then we'll clean down the front of the arm, the hand, up the back of the arm, lifting at the elbow, and the armpit last. We'll set this washcloth aside because it has soap on it. We'll take the third washcloth in the basin and wring it out. And we're going to rinse all the areas that we just washed. So behind the ear, under the chin, across the neck, the upper torso, around the breasts, the abdomen, up the side, down the front of the arm, keeping the elbow supported on the bed. We'll rinse the hand, the back of the arm, and the armpit while supporting the arm. The rinse washcloth can go back in the basin for later use. Now we're going to dry all of those areas. So we're going to pat dry or use short, soft strokes, but nothing vigorous. Go ahead and lift your arm, Miss Jones. We'll set the towel aside. Now the patient has a clean torso, so we'll place the clean gown on her. Ms. Jones, can you reach your arm through here? I'll help you put your gown on. We'll lift the arm at the elbow, supporting it as we lift. And we'll spread the gown out. Okay, Ms. Jones, I'm going to go around to the other side of the bed now, and we'll dress the other arm. Since the care plan said that we only needed to wash one arm, we do not need to cleanse this other arm. That's per the care plan, but we do need to dress it. So I'll remove the soiled gown, and we're going to place this in dirty linen. And then I'll put the new gown on. Ms. Jones, can you reach through this armhole? Thank you. And go ahead and lift. Thank you. Okay, Ms. Jones, I'm going to ask you to turn onto your left side now. This is going to allow me to wash your back and give you a brief back rub. So I'm going to ask you to scoot toward me, and we're going to roll you onto your left side. Ready? Go ahead and scoot toward me. 1, 2, 3. Now the evaluator will hold the mannequin in place while you complete your cleaning. So I'm going to take the third washcloth, wring it out, and we'll soap the top leaf. I'm going to wash the back of the neck, the shoulders, and the back down to the waist. We'll set that washcloth aside. We'll take the final washcloth and wring it out, and we're going to rinse all of those areas. The back of the neck, the shoulders, and the back down to the waist. And then finally we'll dry all of those areas. The back of the neck and the shoulders, the back down to the waist. Now our care plan asks us to give the patient a brief back rub. So we're going to use a little bit of lotion, making sure to warm the lotion in our hands before we give them a back rub. Ms. Jones, I'm going to give you a little back rub now. I'm going to start at the small of your back and work my way up in small circles to your shoulders. We'll do this 3 times. This is for circulation purposes. 1, 2, one more, and 3. I'm going to wipe off the excess lotion. Now I can tie the patient's gown. And remove the towel that's protecting the linens. Ms. Jones, come on back onto your back, please, and scoot to the middle of the bed. Thank you. I do not want to touch that sheet that's going to go right up next to her face with soiled gloves, but I need my soiled gloves to take care of all of my dirty linens. Ms. Jones, I'll be right back. These items are going to go into dirty linen. Now I'm going to go clean the basin. I'll empty the basin and rinse it, and then pick it up with a paper towel. I'll dry the inside with one paper towel and throw it away, and then dry the outside with a paper towel and throw that away. And I'll get one for the drawer. I'll collect the soap and the lotion, placing them in the basin, and return the basin to its drawer for storage. Paper towels can be thrown away. This barrier is going to be discarded, and now I can remove my gloves. Okay, Ms. Jones, I'm going to remove your privacy blanket now and pull your sheet back up. Are you comfortable? Good. We're going to roll the privacy blanket in a ball so that the trailing edges don't contaminate other surfaces. This will be placed in dirty linen. Okay, Ms. Jones, is there anything else I can get for you while I'm here, such as a magazine? No? Okay, here's your call light. If you should need anything at all, please let me know. I'm going to open the privacy curtain and wash my hands. After washing my hands, I'll think about the steps of my skill, make any corrections, and tell the evaluator my skill is done. Okay, Latasha, when you order supplies, we ship out generally the next business day. And we ship from Florida, so depends on where you are. In Florida, you'll get them usually 1 to 2 days, anywhere on the East Coast. So it depends on where you are, but we usually ship out next business day. All right. Any questions on partial bed bath?
No,
Do you guys see how to use the leaves method
yes.
and why we would use the leaves method? Pretty cool, right? Pretty cool. All right. So you have about an hour of practice today built in. I told you that as we go through the program, you'll get more and more practice time. So today you've got about an hour. On Wednesday, you'll have about an hour. On the following Monday, you'll have about an hour and a half. And on graduation day, you'll have about 2 hours. You also have this room available on Wednesdays and Thursdays from the time you end class up until 4 o'clock. So 1 o'clock till 4 o'clock. Okay. Any questions? Homework tonight, you have chapter 7. 7 is another skills chapter, so make sure you're reading the paragraphs in between. And we have a review sheet that I'm going to hand out. Those of you who are attending virtually, you can get all of these review sheets on flcnatraining.com. So I'm going to put that in the chat for you, flcnatraining.com. All of these review sheets are there for you to be able to print out.
Can I get that sheet from last class?
Sure. Absolutely. All right, we're going to go ahead and sign off of online because the students are going to be practicing, and you guys don't need to see that, so give them privacy for practice. So remember, you have the review sheet. The game show is tomorrow. Don't forget the game show if you want to prepare for the written test. It's a free resource for you. All right, until next time, happy caregiving. Bye.
Oh, I can talk now.